Communication in Community and Public Health Programs. Written by Stephanie Pryor, HCA 415, Community and Public Health, Instructor Wanda Carter, April 14th, 2014. Thesis Statement. When it comes to healthcare and the community, communication is one of the major points that must be used to ensure good quality care and a good, healthy patient. Making sure that the patients are aware of what is available to them as far as insurance, free programs, or financial assisted medical services ensure that the patient is able to get the type of care they need, regardless of income or lack thereof. Taking the next step of giving detailed information about the type of care that the patient needs or is going to receive ensures that there are more healthy patients than not, and every patient will be informed enough to participate in their health care. Qualifying for health care coverage. In order to assist the community fully and have more of the patients that need the health care the most receiving it is by making sure that they are aware of how to apply for medical assistance. A lot of programs out there are available and the doctor's offices or the medical facilities may know about them but may not be sharing all of that information with the patient. So therefore we have to make sure that it's getting to them so they know that they may be able to receive services that they need. Having classes or assistance available for patients to learn how to properly fill out needed forms and how to submit them and where to submit them to. This is very important because I've seen in the medical facility that I work in, patients come in and they if they don't speak our language, they just have the tendency to uh, wing it. And what I mean by that is like they'll sign things where they know their signature goes, or things that they know they've filled out on different forms before, but they need to know what's detailed and what's different about each form that they fill out so that they're aware of the information that they're A, giving me, B, telling me that they want me to give them, and C, what they want to relate to the physician, or if it's for state assistance to the government. Letting patients know about the government as well as state assistance that is available to them and what they have to do or will need to do to qualify. There's a lot of programs for single mothers. There's a lot of programs for elderly, pregnant women, infant children, babies up to 5 years old. If people don't know that these programs are out there, they're not applying for them, which means they're not getting them. There's a food WIC program, women and infant children, that I learned about when I was young in a medical facility. Now, this is something that provides you with milk and cheese and bread and different staples that you would need for your child in order to have a healthy, nourished child. And I wouldn't have known had the clinic not told me that those things were available. So some places you'll go and they'll tell you, and some places not. So we need to make sure that in order to keep the communication open, we're letting all the patients know what's available. Making interpretation services more available so that everyone is given the needed information in a language they can understand. This one's a big one for me. I live in a community where it's a lot of people speak Spanish. You have people that'll show up to appointments. I've had to reschedule appointments because they're not able to understand me, or they may try to have their 5 or 6 or 7-year-old translate for them when a doctor is giving you such important information as in regards to your health care. You don't want it to be relayed to someone by maybe, as they say, a 5 or a 6-year-old who doesn't understand the importance, and especially when you can't understand what he's saying to the parent or whatever. You don't know if the information is getting relayed correctly. There's not a lot of services that are available, that'll meet you there with interpreters, and there needs to be more things like that, especially in a community, that has a large Spanish speaking base as the one I live in. Stand up and be noticed. Make sure that information about your clinic, facility, or program is getting to the public. You can have the best programs and info out there, but if no one knows who you are or where you are, it's not going to reach the people it needs to. There are good community facilities out here. There's some for women who just for women who are maternal age. They can go to this place and Monday through Saturday get medical attention. They're open till like 7 or 8 o'clock, and they go based off of your income. This is a program I wouldn't have known anything about, but I heard someone else speaking about it. If it's something that's good, out there in our community, we need to be advertising and letting people know that that's out there available to them. Sharing all of the information you can as a medical facility with the patients so they are able to pass it on to others that may need help too. It is so much easier to understand something that may be told to you by a friend or an acquaintance that's been in your situation than it can be to talk to a stranger that may not know what you really need or can explain it to you where you understand. And that just like Planned Parenthood, for example, it's a good program for women because you can go there and you can talk to a woman, you can talk to different people who have been in your situation who may be able to help you. You can get some kind of counseling, you can get talked to before you make any kind of decision. And it's like when you have a problem, you want to know that they know what they're talking about, and it always helps if they know what they're talking about because they've been in that situation. You're more likely to find out from someone who may have been in that position and pass it on to you. But however you can get the information out there, by all means. We need to express to the state and government facilities and programs that supply our community with funds what's actually needed in your particular community. Not everybody's going to have the same needs. Not everybody's going to want the same thing. So whatever is whatever you're seeing as the most cases in your community, be it teen pregnancy or breast cancer or things of that nature, then you're going to want to let the government know that these are things that you need funding for. You need more funding for these particular programs, and you may be able to take away from some programs that you don't use a lot of funding for. You can also have fundraisers in your community, sell cookies, go to the fair, have a booth at the fair. There's all different kinds of things that you can do that not only lets people in the community know that your services are available to them, but people that may want to donate or may have received services and want to know how they can give back to other people who may need them, would also be able to do so that way as well. If you want to get it, you have to give. Medical treatment or one-on-one. No matter what the situation or income, there needs to be great medical staff in place to transfer needed information to the patients. A doctor has to be able to relate to his staff, to the patients, as well as the patient's family. Now, this can go as far as starting from the janitor and what needs to be used in cleaning the floor to make sure that all the bacteria is getting killed and all of, the floor is not going to be slippery to where somebody can trip on it, or it's not going to be something that somebody can breathe in, all the way up to a doctor telling you what kind of medical test needs to be given to the patient, and you have to relay that information to the patient, whether it's a procedure that you're going to do or if it's something they need to go somewhere else and get. All of these details are important to ensure that you have a good community program base. If you have a good community program base, you're able to communicate within any aspect of your job, of your clinic, of your medical expertise, then that shows that you have great communication skills, and therefore you're able to talk to anyone about anything. If it's medical advice or diagnosis that the doctor is giving to the patient needs to be able to understand what he's being told, and especially when it comes to their continued care and health. If they need to go somewhere and do something else to ensure that they'll be able to get better from whatever you've diagnosed them with, they need to know exactly what they need to do. They need to know that if they don't do this, what could happen? If they do this, what could happen? Different places that they can go to get this assistance from. Medical staff also has to be able to have respect and understanding for each individual patient and situation. One has to be able to relay the needed message without inflicting their own personal beliefs or even being unsympathetic to a situation that you may not understand. How you communicate is just as important as what is being communicated, excuse me. You have to be able to talk to a patient. If you are black and your patient is white and you've had totally different upbringings, you still have to be able to relate to that patient. If you're Muslim and your patient is American and they want to have an abortion or something that you might not be able, to agree with religiously or whatever, you have to still be able to communicate with them in a way to where they feel like you have their best interest at heart and the information that you're giving them is accurate and true and what's best for them. Conclusion: It doesn't matter what the information is that you are trying to communicate within your community. Figuring out the best way to get all of the needed information to as many people that need it should be goal number one. People are more likely to assist in their medical care if they know how. Making sure that all the programs that are out there are well informed of facilities and that they may be available to them, or where they can go or what they can do. All of this information needs to be out there because it's going to be a healthy community because of it. The patients are going to be able to get that preventative care. So maybe they don't need the emergency care anymore. Maybe they'll be able to have healthier children and keep their children vaccinated so that they won't have to worry about their kids getting sick. It's like if they know that the medical programs are out there that they may qualify to where they can afford healthcare coverage, then more people may be able to go get it and in turn have a healthier community. Making sure that you are relaying the message of what is being needed in your community to those that can make the changes happen. Legislation, go to your state capital, write a letter to the president. If you feel that there's something that needs to be done in your community and it could save lives by all means, do whatever it takes to make sure that that happens. There can be no questions of what is needed if there is constant communication between both facility and community. Express what is available for the patient and listen when the patient explains what's needed as well. So it may not just always be you trying to tell somebody what they need to do or what they need to know. It can also be them relaying the message to you. Thank you.